Do you also have sleepy frontal lobes? I saw a great clip recently of Dr. Mike interviewing Dr. Amen on his podcast. And in this clip, Dr. Daniel Amen discusses a clip where he has done a SPECT scan on Kim Kardashian and explains that she had a sleepy frontal lobe on this SPECT scan. Dr. Mike goes on to ask him, why is it that most psychiatrists don't do these scans? And why is it that the American Psychiatric Association doesn't recommend this? And as a psychiatrist, I thought I'd maybe answer that question. I thought I'd maybe weigh in a little bit on what are SPECT scans, and if they're amazing, why are we not all using them? Why wouldn't I use something that would help every single one of my patients? There's some good answers. So what these scans do is measure blood flow to certain parts of your brain. So for example, in that clip, there was a front part of the brain, the frontal lobe, where Dr. Amen says there was low blood flow to that area. That's what you kind of see in these beautiful colored pictures on SPECT scans, unlike MRIs, which are black and white, which is so boring. Now in psychiatry, we often will use an MRI or a CT scan to exclude things. If a patient, for example, says to me, hey doc, I'm seeing people that are not in the room. Well, that could be because you have a psychotic illness, or it could be because you have a brain tumor. So I need to first know that you don't have a brain tumor, and I'll do an MRI to check for that first before prescribing you an antipsychotic. Now, the APA, or the American Psychiatric Association, actually has a position statement on how we use imaging in psychiatry, and it guides the way that we approach that topic. There are 3 reasons I want to share with you why SPECT scans are not commonly used and can actually do a little bit more harm than good sometimes when used for everybody all the time. The first one is that they're not specific. For example, if you have low blood flow to a certain area in the brain, that could be because of 5 or 6 different disorders. Maybe it's depression, maybe anxiety, maybe PTSD. All of that can cause low blood flow in the frontal lobe. So it actually doesn't help you in any way in terms of being specific to one disease. Secondly, it has low predictive value. It's not saying, for example, if I find this one thing on the pretty picture of the SPECT scan, that's going to make me as a clinician do X or Y. And that was even admitted by that psychiatrist on Dr. Mike's podcast. So if it's not reliable and it's going to change my management, why do it? And third, which I think is most important, is that it actually lends itself to being over-interpreted, and there's a cognitive bias that can happen. And if you're a patient that doesn't really know any better, and I can show to you, you know what? Here's a picture of your brain. Isn't that fascinating? Isn't that beautiful? This is your brain in 3D, and I can show you, and it's green and red, and it's just visually appealing. That can make you feel like, oh, this is then specific to me, and what's coming out here, you won't really find in anyone else. Even though we haven't been able to show that in the study, that if I do this picture of your brain and the person next to you's brain, it's not going to change the way we do treatment for you, and it really can kind of actually bias our whole treatment approach. And the last bonus one I would say is actually radiation exposure. Even though it is a low radiation exposure, but it's not nothing.